should be better informed about the risks posed not just to their children, but to the community at large. Number 3, prevent HPV-related cancers by gathering and reporting more information on vaccination rates at the local level so that resources can be better and more efficiently targeted, and by allowing minors to consent to their own vaccination against this cancer-causing virus. HPV-related diseases and cancers cost the state $170 million annually and comprise 5% of cancers worldwide. But even more significant, there were 2,900 deaths in Texas from cervical cancer from 2009 to 2013. We see it not only in the form of cervical cancer in women, but a rising incidence of head and neck cancer in men. Yet only 60% of young women and 41% of young men have received their first vaccination against HPV. Number 4, change the state's immunization registry, MTRAC, to an opt-out system, meaning that children would be automatically enrolled unless their parents take a simple step to opt out, in order to improve immunization information in the registry and reduce the burden on healthcare providers. I am delighted to be joined today by 2 outstanding leaders in the bipartisan effort to rid our state of vaccine-preventable diseases. Donna Howard, a nurse by trade and a representative for Austin for more than a decade, and Sarah Davis, a cancer survivor and soon to be 4-term representative for Houston. State Representative Donna Howard of Austin has been a leader in the effort to prevent what's preventable, advocating for a more efficient immunization information system and education for parents about the true benefits and risks of vaccination. As a nurse, she knows the vital public health interest in ensuring that we have high vaccination rates. I would like to ask her to share some of her comments with us this morning regarding the bills that she has filed.
Thank you, Anna. It's true, I've been working on this for quite a while, many sessions. As a nurse, as a health educator, I am interested in evidence-based policy. The Centers for Disease Control have said that vaccinations, immunizations, are one of the leading efforts of the 20th century to improve the health care of Americans. It is really no-brainer. I keep using that because there's so many things that I think in this that we're dealing with here that are no-brainers, but this is clearly one where we can prevent disease, we can prevent death if we have appropriate immunizations. As a grandmother, I also am concerned about my newest grandchild, who is under 2 months of age, not able to be immunized yet, and who is subject to being around someone who has chosen not to be immunized, thereby compromising his health. As a policymaker, I am interested, as I said, in evidence-based policy that promotes the public good. The fact is that people have a choice to not immunize, but we need the herd effect. We need a significant number to be immunized to not only protect themselves, but protect the larger community. The legislation that I've filed repeatedly has to do with our MTRAC system to make it much more efficient so that it would be actually representing the vast majority of Texans who want their information stored in the registry, and that would change it from it helps the providers to make sure that they give the right vaccine to the right person at the right time. It's a very simple thing that can improve the delivery of health care in our state. there is no reason to not make it a more efficient and effective system. The other legislation I have is to create an educational opportunity for parents prior to their decision about whether or not to vaccinate their children. They would be required to get information from their physician about the benefits of vaccination and have their questions and concerns addressed before they are signed off on being able to opt out. That's, again, another common sense way to make sure that parents are given all the information they need to make an informed decision. This is simply about improving the health care of Texans and preventing preventable diseases.
Thank you, Representative Davis. I'm sorry. Ooh, we have a microphone down. Thank you, Representative Howard. State Representative Sarah Davis is a leader in the fight to eradicate vaccine-preventable diseases in Texas and has filed 4 pieces of legislation to improve vaccine policy in Texas. I would like to invite her to share some remarks with us this morning.
Well, thank you, Anna. It's good to be here and to be joined by my delightful colleague, Donna Howard. We both share a passion for healthier Texas. And given the weather this morning, I hope you all have had your flu vaccine. Myself and my staff all had ours last week. As we return to the Capitol building for another legislative session, we know that there will be many vigorous debates in the coming months on the House floor. But let there be no debate about the effectiveness of vaccines. They work. The science is 100% on the side of those who advocate for widespread immunizations to eradicate vaccine-preventable diseases. Vaccines were one of the medical marvels of the 20th century, eradicating diseases like polio, which was so devastating less than 100 years ago for those that were afflicted by it. But for some reason, there's a growing movement afoot to question the science and effectiveness of vaccines, which has led to a 19-fold increase in the number of non-medical exemptions in our public schools since 2003. Discredited research offered by discredited sources. But sometimes parents don't know, and sometimes adolescents are not willing to have that conversation with their parents. That's why I've authored legislation for adolescents age 14 and above to legally offer their own consent to receive the HPV vaccine. This is about cancer prevention, pure and simple, and allowing adolescents to protect their own health today and in the future. Secondly, I have written legislation to study and report vaccination rates at the county level. Texas has some of the highest rates of cancer in the nation. This bill will give us a better, more detailed information to deploy limited resources that we have in a more cost-effective manner. A third piece of legislation I filed will require parents to take an online education class in order to receive a non-medical exemption for their child. This will not infringe on a parent's right to opt out of vaccination requirements, but it will help stop the many cases where parents opt out for matters of convenience and not based on personal conviction. It will give parents greater information about the safety of vaccines and the risks posed in not administering them. And lastly, I have authored legislation to change statutory language that today refers to conscientious exemptions to non-medical exemptions. Again, this preserves a parent's right to choose while taking the state out of the business of offering moral identifiers associated with such choices. Exemptions that are religious or made on other non-medical grounds will be classified as non-medical as opposed to the rare exemptions that are offered for medical reasons. I respect parents' rights. I also want parents to have access to the best information when it comes to a decision that could affect the life and death of their child. Cancers that are preventable should be prevented, and viruses that are preventable should be eradicated, and the safety and efficacy of vaccines should not be debated. Those who choose not to vaccinate their children can continue to do so in Texas, but every parent should know the potential cost, including the cost posed to children whose immune systems have been compromised by cancer and other diseases who are too frail to receive certain vaccines. When it comes to vaccines, the consequences of exercising your rights cannot be contained within your family. High contagious diseases carried by the unvaccinated can harm and kill other children, which the medically frail or our youngest little Texans who are not old enough to receive the vaccines. We each have an obligation to the communities we inhabit to stop the spread of preventable diseases, to keep our children healthy and safe, and that's